Question 81. The presence of which of the following electrolytes contributes to acidosis? A. Sodium. B. Potassium. C. Hydrogen. D. Chloride. Question 81. Answer: C. Hydrogen. Question 81. Explanation: the presence of hydrogen ions determines a solution's acidity. Question 82. The lungs participate in acid-base balance by A. Reabsorbing bicarbonate. B. Splitting carbonic acid in two. C. Using CO2 to regulate hydrogen ions. D. Sending hydrogen ions to the renal tubules. Question 82. Answer: C. Using CO2 to regulate hydrogen ions. Question 82. Explanation: the lungs use carbon dioxide to regulate hydrogen ion concentration. Question 83. The respiratory system regulates acid-base balance by A. Increasing mucus production. B. Changing the rate and depth of respirations. C. Forming bicarbonate. D. Reabsorbing bicarbonate. Question 83. Answer: B. Changing the rate and depth of respirations. Question 83. Explanation: through changes in the rate and depth of respirations, acid-base balance is achieved via CO2 elimination and retention. Mucus production is not part of the pulmonary regulatory system. C and D are responses that refer to ways in which kidneys balance acids and bases. Question 84. Which of the following is a gas component of the ABG measurement? A. Carbon dioxide. B. Bicarbonate. C. Hydrogen. D. pH. Question 84. Answer: a carbon dioxide. Question 84. Explanation: the gases measured by ABGs are oxygen and carbon dioxide. Bicarbonate and hydrogen are ions, their ratio is measured in the pH. Question 85. Chloride helps maintain acid-base balance by performing which of the following roles? A. Participating in the chloride shift. B. Following sodium to maintain serum osmolarity. C. Maintaining the balance of cations in the ICF and EC. D. Separating carbonic acid. Question 85. Answer: a. Participating in the chloride shift. Question 85. Explanation: to maintain acid-base balance, chloride shifts into and out of red blood cells in exchange for bicarbonate. Question 86. Which of the following hormones helps regulate chloride reabsorption? A. Antidiuretic hormone. B. Renin. C. Estrogen. D. Aldosterone. Question 86. Answer: D. Aldosterone. Question 86. Explanation: chloride reabsorption depends on sodium reabsorption, which is regulated by aldosterone in the distal tubule and collecting ducts. Question 87. Chloride is absorbed in the A. Stomach. B. Bowel. C. Liver. D. Kidney. Question 87. Answer: B. Bowel. Question 87. Explanation: chloride is absorbed in the bowel, mainly the duodenum and jejunum. Question 88. When chloride concentration drops below 95 mg/L, reabsorption of which of the following electrolytes increases proportionally? A. Hydrogen. B. Potassium. C. Sodium. D. Bicarbonate. Question 88. Answer: D. Bicarbonate. Question 88. Explanation: when chloride concentrations drop below 95 mg/L, bicarbonate reabsorption increases proportionally, causing metabolic alkalosis. Other choices are cations. Chloride is an anion. A cation must always exchange for a cation in order to maintain electrical neutrality. Question 89. Jonas is admitted with 1,000 milliliters of diarrhea per day for the last 3 days. And 4 of 0.45% NaCl mixed with 5% dextrose is infusing. Which of the following nursing interventions is the most appropriate? A. Get an infusion controller from central supply. B. Mix all antibiotics in 0.45% NaCl with 5% dextrose. C. Check the patient's potassium level and contact the doctor for 4 additive orders. D. Assess the patient for signs of hyperkalemia. Question 89 Answer. C. Check the patient's potassium level and contact the doctor for 4 additive orders. Question 89 Explanation. Potassium is lost via the GI and renal systems. Prolonged or excessive diarrhea can lead to hypokalemia. In the event of hypokalemia, a potassium additive would likely be prescribed. Question 90. Mrs. Waltrad is receiving digoxin and Lasix daily. Today, she complains of nausea, and her apical pulse is 130 and irregular. Which of the following nursing interventions is the most appropriate? A. Hold the digoxin and check the patient's potassium level. B. Remove the orange juice from the patient's tray. C. Identify the patient as high risk for hyperkalemia. D. Assess the patient for other signs of hypernatremia. Question 90 Answer. A. Hold the digoxin and check the patient's potassium level. Question 90 Explanation. Patient experiencing hypokalemia are at risk for digitalis toxicity. Nausea and irregular pulse are signs digitalis toxicity.